Good to have you with us, Sean. And I want to start with talking a little bit about Virginia's hospitals. Your organization, the Virginia Hospital and Healthcare Association, represents nearly all of the hospitals in Virginia. Let's talk about the pending Supreme Court decision, Sean, in the King versus Burwell situation. Can you familiarize our listeners with the issue, what's at stake, and what happens if the Supreme Court says, sorry, if you don't have a state exchange, you're out? What happens?
Yeah, this is the latest and obviously a series of lawsuits that have been brought against the Affordable Care Act. This one involves, actually, it's a statutory interpretation, and where the law actually says that if a person buys a policy through a state exchange and they meet certain income criteria, then they can get a subsidy or some type of tax credit. Virginia, like many other states, don't have a state exchange. They actually rely on the federal exchange. So the lawsuit is about whether those people, like in Virginia, like in maybe almost 30-something other states, whether they should be getting the subsidies or not. And we're expecting a decision from the Supreme Court maybe as early as next Monday, but most likely the 29th. And everyone's sort of standing back and holding their breath about this one because in Virginia, we have almost 400,000 people who have bought policies through the federal exchange. About three-quarters of them actually are receiving subsidies. So you have the potential that almost 300,000 people, or over 300,000 people, could end up losing their insurance. And if you kind of think about what the impact is, it's not just about the fact that they own the insurance and how it impacts whether they use health care and go out and go to providers, but the whole insurance pool is all determined based on the fact that these 300,000 plus people are in the pool. And so it could end up having dramatic impacts across all commercial insurance. So we're all getting ready to see what happens. I mean, it's the Supreme Court. Everyone has a lot of thoughts and conjectures about how they may end up coming out. The thing is, at the end of the day, the Supreme Court, is it's hard to figure out. Like they saw with the couple of other big Affordable Care Act cases, it's hard to really read where and how they're going to come out on this decision. But it should be within the next 2 weeks.
Well, you know what, Sean? I am out of the business of predicting what the Supreme Court does and what juries do ever since OJ. I'm done with that. So you really do. I mean, hit it on the head. You can conjecture and try to say, what will this justice do or that justice do? But you look at the decision, the way Obamacare came down, nobody would have thought that John Roberts, of all people, would have flipped and been the deciding one. So you don't know how this is going to turn out. But look, bottom line, this is catastrophic consequences, Sean, because at the end of the day, if the Supreme Court rules, if you don't have an state exchange, you're no longer eligible for the subsidy. As you said, this is 400,000 Virginians that are either receiving right now their Obamacare health insurance for free or is being heavily subsidized. I was saying this to a state Senate candidate we had on earlier from Northern Virginia. I mean, there's never been a time in history that I can remember where we've had an entitlement and just taken it away in one day. So there's going to have to be some plan. And how would your association be involved in crafting one?
Well, what's interesting is we've already started to look around. The American Hospital Association and other national organizations have been helping us all look at this issue about how do we potentially respond if the Supreme Court rules that the subsidies are illegal. I mean, the easiest thing to do would be, obviously, Congress could correct the legislation and correct the verbiage, or the other extreme or the other option would be the state actually stepping forward and setting up some sort of state exchange or contracting with the federal exchange. And so, I mean, we're looking at all the options, and it's really going to be what the final language of the Supreme Court decision, what it ends up saying, and it's interesting, John, is it's not clear cut as to what a state exchange is and what a federal exchange. There's various criteria about what is considered a federal state exchange. Virginia does some of the things for the federal government in helping people currently get insurance on the federal exchange. So some states are, right now already contracting with the federal government for running the exchanges in their states. So there's a lot of moving parts on this, and it's interesting. I had the opportunity several years ago to go to before the Supreme Court on a case, and we thought we lost, and we ended up winning an unanimous decision. So you never know until that decision comes out. We'll see that again probably within the next 10 days.
Absolutely. You hit it on the head, Sean. You just don't know. Common sense. I want to get to rural Virginia, Sean, and maybe you can shed some light on this for us. When we get to those that are receiving subsidies now under Obamacare, obviously going to impact people in rural areas. But, Sean, there is an epidemic going on in the United States right now, not only in Virginia, but throughout the country. Hospitals in more rural areas are losing money, going out of business, cutting services. And why this is really an epidemic crisis now in Virginia and the U.S. is obviously if you're in a rural area, hospitals are further and farther apart than if you're in a more condensed area. And so what's happening now is rural hospitals are either cutting services, so instead of going 50 miles, you have to go 150 miles or 200 miles, and then they're just shutting down altogether. How do we solve it? Why is it happening?
Well, it is truly a crisis in rural health in Virginia today and across the country. But obviously focusing on in Virginia, according to our numbers, John, about 74% of the patient mix at a rural hospital in Virginia is someone with Medicare or Medicaid. And another 6% are indigent. People don't pay anything at all. So right now, if you look at that sort of payer mix, the federal government state is only essentially reimbursing the hospitals for 85 cents on the dollar for the care provided to a Medicare patient. The state is only reimbursing on Medicaid 66 cents on the dollar. And then you have, 6 or 7% of the people who are your patients who are paying nothing at all. So you're looking at 80% of your customers essentially are providing little or nothing for the full cost of the care. And you're seeing out in the rural Virginia, obviously a lot of loss of jobs, so you don't see as many commercial payers. You see people who are obviously older, and the population's getting older as the younger people move to find jobs. And then you see some real chronic conditions, and everything from various illnesses to substance abuse. And so it's a mix that when you step back, you look and realize that the hospitals there, in fact, almost half the rural hospitals in Virginia are currently operating in the red. And many of them are getting to the point where you're starting to see, like you mentioned, people go, well, the hospital's still there, but what they don't realize is that behind those doors, they're seeing less and less services being provided. In fact, if you're someone out in Southwest Virginia, you have to travel hours if you want to try to deliver a baby.
Right.
Because there's no OBGYN services out there. And so the hospital's there, the building's there, but what's happening behind those doors is less and less services being provided, and this is something that is going to continue to get worse, because people just don't really want to focus on the fact that it's both the payers and the providers, what they're getting reimbursed, and then how do you end up dealing with a population that is getting older and sicker and has very, very special needs. And this is something we're grappling with. We're trying to get our General Assembly to really pay attention to it. In fact, just recently, some of these challenges down in North Carolina resulted in some hospitals closing very quickly. I mean, the local mayor of one community in North Carolina actually walked from his town all the way up to Washington to try to highlight what is happening, because not only is it the loss of the health care, I mean, in almost every community, and particularly in the rural communities, the hospitals are the biggest employer.
Right.
And so not only do you lose that care, but then all of a sudden you lose those jobs, and then the ripple effects of those jobs. And then, you see right now whether the General Assembly or the governor is running around trying to get jobs coming to Virginia, no economic development prospect is going to locate in a community if it doesn't have a decent hospital and healthcare system. And so it's self-defeating for us in the long term if we don't end up addressing this situation.
It absolutely is, Sean Connaughton, and it's not only, as I said earlier, in Virginia, this is an epidemic that's running across rural areas in the United States. You mentioned North Carolina. I can mention many other examples, and you get a simple thing like trauma. Right now, if you're in Southwest Virginia and you have a trauma situation, a head injury, I mean, depending on where you are, you could be 4 hours away from getting to a trauma center. As you know, when you have head trauma, every minute critical to saving that person's life. I mean, this is a real issue. I want to get to Medicaid expansion. As you know, Sean Connaughton, this has been a very polarizing issue, the subject of great debate in the Virginia General Assembly. Give us an update on that.
Well, obviously, this is an issue that has been fought about really pretty much ever since, again, the Supreme Court in an earlier decision decided that it was up to the individual states to make the final decision as to whether they expanded Medicaid. And so we had obviously this fairly big fight last year over the budget and about whether the potential of getting Medicaid expansion passed last year. It came up this year again with the governor proposing it, and it's still an issue that's out there, John. And really at the heart of it is this issue about the uninsured. As I mentioned before, most hospitals are seeing about 6 or 7% of their patients are people who are uninsured completely. In every state that has expanded Medicaid, they've actually seen a dramatic drop in the uninsured, and so that helps the bottom line of the hospitals. This is one way to help those rural hospitals in Virginia, is by addressing some of those that uninsured population out there, that you'd end up actually seeing some money coming into the hospitals for compensating what are currently people who are paying nothing at all. But this is something that's not going to go away, particularly because the money's there. We're paying those taxes. I mean, one of the things we keep on trying to point out to folks is one of the things with the Affordable Care Act, or various taxes and fees that went along with it. Virginians are paying those, and what you're seeing is that we're not seeing the money coming back. Now, why this is going to be more critical as we go along is another part of the Affordable Care Act, as well as with sequestration, along as with this tax reform bill they passed a couple of years ago, is that they've dramatically cut the reimbursements coming for Medicare to hospitals and providers. And so this year in Virginia, we saw about $500 million cut across the board for our providers. In about 6 years, that goes up to $1.5 billion. And so we're facing a crisis now in rural Virginia. It's going to be you're going to face it across the Commonwealth as we see Medicare being cut. And so, where are these additional dollars going to be coming from? And that's why Medicaid expansion has been such an important issue for the hospitals and healthcare. It is a pot of money that will help provide some compensation for the fact that we right now are providing so much coverage and care to people who are currently uninsured.
We're with Sean Connaughton. He's the president of the Virginia Hospital and Healthcare Association, biggest healthcare association, obviously, Commonwealth of Virginia. Sean, we got a couple more minutes. Basically, we have 400,000 people in Virginia not getting insurance because they don't qualify for Obamacare, and they can't buy their own insurance. We have 400,000 people that are on Obamacare in Virginia and getting a subsidy. So this is about 800,000 people, almost 1 million people in Virginia. This is a big number of uninsured or potentially uninsured Virginians that we have. So that kind of gives everybody an idea of the situation we have. Now, I've seen some chatter recently about this so-called CON, I hate acronyms, Certificate of Need situation. I just hate all these acronyms, Sean. And Virginia is one of about 36 states that have this law, which basically means in order to put a hospital up, you have to have a need for it and show that there's a need in the area. There's been some agitation by some to repeal that in Virginia. I've got 2 minutes. What's the deal with that, and how do you stand on it?
Well, I mean, this law has been around for maybe 4 or 5 decades. Federal government mandated that you have CON at one point. Every state needed to have it. Some states, but then the federal government took that mandate away. Basically, what it does, it regulates and makes sure that you don't see in certain areas, too many services, too many facilities, and others not being served at all. So they have a statewide medical plan that looks at where we should have hospitals, where we should have other types of services, and then tries to make sure that facilities exist in those and that those services are provided. The issue for us has been that, the whole system's built on this, and so again, it's sort of like whether you're talking about the Supreme Court just potentially doing away with the subsidies in one swoop. That's one of our bigger challenges here, because if you think about it, the entire system is built on the CON law and the state medical plan. It's in practically every bond rating that's issued, where the bond rating agencies look and say, okay, you got the CON law, we understand what the marketplace is like. Our biggest challenge, John, if you look at just overall, since the Affordable Care Act got passed, there's been dramatic changes in how we provide care, about how many people and how we let them into the hospitals. In fact, we're essentially now discouraged from bringing people into hospitals and having them stay overnight, because that's the most expensive care. In fact, very few, just a handful of hospitals are actually 100% capacity. So right now, we think it's really a challenging time to be trying to undo this law. It's not a competitive marketplace. By law, hospitals have to take anyone who walks in that door with or without insurance. We end up seeing that with the CON, the state actually mandates a great deal of charity and free care that goes along with it. What happens to all of them? I mean, so there's a lot of moving parts on this. We think we have to really take a look at it, and if we're going to do away with it, come up with a phased approach that ends up addressing the long-term needs and provider needs of the Commonwealth of Virginia.
All right, Sean Connaughton, we're out of time. We want to thank Sean Connaughton, the president of the Virginia Hospital and Healthcare Association, for being with us today. Sean, I've got to get into this CON issue in a little more detail, so if it's okay, let's have you back in a week or so, if that's all right, Sean.
That sounds great.
Because I think it's a big issue, and it's kind of one of those things that goes under the radar screen that people have to understand. More info, go to VirginiaHealthCareServices.com, VirginiaHealthCareServices.com. Again, we want to thank Sean Connaughton for being with us. Thanks, Sean.